In Health Watch this week marks 1 year since the World Health Organization recognized COVID-19 as a global pandemic. It can be a particularly difficult time for some people after a year of collective loss. And some mental health experts say feeling lower than usual this month is actually normal. For more, let's bring in Dr. Roger McIntyre. He's a professor of psychiatry and pharmacology at the University of Toronto. He is also the CEO of AltMed, a pharmaceutical company. Dr. McIntyre, welcome. Thanks very much for being with us.
It's great to be with you. Thanks for covering this topic.
So, in some ways, it is really hard to believe that a year has passed since we saw the widespread stay-at-home orders put in place. There's been such tremendous loss for so many people, not just in the United States, but around the world. What do you think, Doctor, is important for people to understand about their reactions, their thoughts as they go through this period of time?
Well, I think people should be aware of the fact that there's a tremendous degree of stress. I mean, we've all signed up around the world for an experiment that nobody wants. This has been an experiment on trauma and chronic stress. And, when we go back, it's hard to imagine. It's been a year now that we've been in this situation. Before this started, there was a prelude. And the prelude to this was, as a society, there was rising rates of loneliness, rising rates of mistrust, and lower rates of happiness across the American population. That was the prelude coming into this. Then we're faced with the trauma of this, the economic insecurity, and above all else, a sense of helplessness. I mean, how much stress do we need? All of this, in fact, adds up to feeling down. People feel tired, they're fed up, they're irritable, they're angry, and they don't really know when this thing is for sure going to end. And it's that uncertainty that has this very negative effect on how we feel. So it's a very understandable reaction.
And, add to that this concept of quote unquote pandemic guilt, where some people feel guilty that you've had 12 months that have gone by, and in their view, they didn't utilize their time better. What would you say to folks who might be feeling that? What are some ways that they can maybe rethink or adjust the way that they think about that?
Well, I've heard this from so many people about pandemic guilt, and it cuts across different areas of life. For example, the way you described it, they feel as though they didn't do as much with their life. I always bring up the example of Sir Isaac Newton. Back in 1625 at Cambridge in the UK, he was also under home quarantine because of the bubonic plague. And while he was under house arrest, he invented calculus, and he also discovered laws of gravity. Most of us are not that productive at home. It's extremely difficult to be at home and to do all kinds of things we've been asked to do. And I would say that for some people in our society, it's been especially difficult. For example, people who are single parents, our female population has really taken the brunt of this, not just emotionally and psychologically, but economically, invoking this new phrase called the she-cession, the recession that's really differentially affecting women. So there's no doubt about it that it's difficult to perform given the amount of stressors in the changing environment and, frankly, the lack of boundaries that exist in our lives today. So I think, in fact, there needs to be a gift to ourselves to give ourselves a break. Give ourselves a break. Here's the good news. The good news is we have vaccines, and they are rolling out, and they're rolling out more efficiently now than they were, say, a month or two ago. We're seeing them moving out. That gives us a finish line. It gives us a finish line that we all need. So there is some degree of certainty. This will end. Yes, there'll be some outbreaks in the fall. Yes, there's some variants circulating. We need to respect public health recommendations to the T. But that being said, we have this finish line. And I think what's happened is that people are so drained, they're so stressed, and in many cases feeling very insecure, not just psychologically, but economically. They don't feel they have the resilience. This is why I think it's so important now more than ever. We're in the fourth quarter of this football game. Now more than ever, we've got to really stay to the game plan. We need portion control. We need to get some portion control on sleep and exercise. Alcohol consumption has to be very moderate, but keep socially connected to people that you feel you've got connection with. The CDC came out yesterday For those who've been vaccinated, there's a little loosening of the rules now with respect to social connection in person. We welcome that. That's only going to get better. And that's a powerful resiliency for us. So we got to stick with the game plan, especially in this fourth quarter of the football game.
Can you just talk about this idea of connection a little bit more? Because, for instance, what are some of the longer-term impacts on mental health that can come with a year of isolation? We know there is so much science out there that shows, as human beings, we are meant to connect. We are meant to socialize. And when you talk about, trying to maintain these connections, of course, we're talking about doing that in a safe manner,
Right.
in whichever way is available to you. If you have the technology where you can do that, if there is a way to do that safely in person. But as human beings, we are not designed to be in isolation.
You're right. And this has become a double whammy because in addition to what you just said so accurately, we have had, millions of years of evolution to be social creatures. And so that's been taken away from us, that interpersonal, in-person contact. That's a stressor. The other part, which is the double whammy piece, is that when we're under a lot of stress, the most effective way to boost your resiliency in this situation is to be in the company of other people. So it's a stressor to take it away, and we don't have the resiliency to fall back on. So that's why I think this has truly been a double whammy. And as human beings, the reason why we have evolved to be social creatures is primarily for our protection. In fact, that's why we have evolved to be close to others. And what have we faced for the last 1 year? Threat 24 hours a day in one form or the other, whether it's the public health crisis, economic challenges, housing insecurity, the list goes on and on. So this has been especially difficult. And I think, look, the first week after this thing all started last March, for many of us, Zoom parties on the weekend, hey, they were kind of cool, kind of novel. They are lame. And I don't think anyone across the country wants that anymore. They are so lost in terms of interesting, and people are beyond Zoom fatigue. They're Zoom angry. They want to get their lives back. It's in our DNA. And so it's not surprising that people feel this way. It's human, and that's what we would expect.
I want to ask you specifically, Doctor, about children and teens, because several studies have shown that they are struggling more than others right now. When you look at the situation that so many of these students and these children are in, when you look at the school setting, how do you think schools can provide more assistance to children who are in need?
Well, you've really highlighted a population, a group of our society that are especially at risk. And maybe not everyone's clear on this. We have certainly come to learn that our older population is more susceptible to contracting and having complications of COVID-19. But from a mental health perspective, it's actually our younger population that's doing worse off. Again, there was some risk coming into this. They had higher rates of loneliness and social isolation. But our younger population, often they're not in school now. Many folks have lost their job. Many of these folks live alone. These and other factors have conspired to create a real intense level of anxiety and depression. You mentioned schools. I think we're all looking forward to schools opening up. It's good for children's social development, obviously their educational development, and their just general sort of cognitive development. And that's all a good thing. We agree on that. I think what schools will really need to do is what society, I think, is going to need to do. I think coming out of this COVID-19, and this is perhaps a hope that I have, we have greater awareness for and more openness around mental health and mental well-being. And everyone's gotten a real heavy dose of trauma and stress this last 1 year. And I think that's probably made people a bit more sensitive to this matter. And I think we need to have psychiatric first aid programs at the state and federal level that can be accessible, high quality, and accountable to deal with these issues. The last thing that we want to do is have this COVID-19 come to an end, which we all want, only to be followed by spikes or prolonged, elevated rates of mental illness, distress, and certainly not suicide. I really reacted with a lot of concern about 2 weeks ago. Report came out of Japan that younger people under the age of 30, especially young women, but men as well, there was a tremendous spike in suicide in Japan. And there's not one factor that leads to suicide. It's a very complex behavior, but there certainly has been implications that the alienation of our younger population, the fact that they're so socially distant, despite the fact that they're socially connected, that's not the same thing as being socially closed. And thirdly, there was really, in fact, a real tremendous economic insecurity. These factors and others probably contributed to this rising risk. So I think we've got to be very attentive to this. What we need out of this is we need better, accessible, high-quality health care for people at risk of mental illness. And I think the younger population, especially, is a group we're going to need to keep a close eye on.
In our final minute here, I do want to get your thoughts, Doctor, on the recent interview with Meghan Markle, where she opened up about having thoughts of suicide. What was your reaction as someone who deals with the issue of mental health, hearing someone in her position talk so very publicly about this?
Well, it reminds us that suicidal thinking is not confined to one subsection of our society. It can affect any part of our society. Obviously, a very concerning statement by Meghan Markle during that Oprah Winfrey interview. What I would say is that we need to conceptualize suicidal thinking and suicidal behavior as very complex. There's not one single reason for this, why someone would be feeling that or thinking that. And there's never been one reason why anyone's ever committed suicide. What I think is important to come out of this, and what I hope does, is that we have a public conversation about suicide. We now have new, phone lines people can contact, etc. That's important. But I think, in fact, what we need to do as a society is have this open conversation. What are the factors, yes, that are sort of putting someone at risk, but what are the factors that can protect people against suicide? And I hope, in fact, we're going to learn more about that after COVID-19 is over.
Right, taking care of our mental health is taking care of our health. All right, Dr. Roger McIntyre. Doctor, really insightful conversation. Thank you so much for talking to us.
Thanks for having me.
If you or someone you know is struggling with suicidal thoughts, the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. The number is 1-800-273-8255 or text TALK to the number 741-741.